Good morning, everybody. This is the 13th of January, 2021. It is the first reopening committee meeting of the new year. And of course, Happy New Year to everybody. It is a bright New Year. Caroline knows I can barely contain my excitement at the advent and the availability of vaccine. I think this is a really exciting time for us. And we'll talk about the vaccine a little bit this morning. But I want to welcome you all back. I want to thank you again for your commitment to this process. It's been a long road, but we are definitely now seeing a light. And for me, that's really exciting. And I know it is for you too. A couple of quick updates for today. We'll be talking a little bit about possibility of screening testing. We'll be talking a bit about what's happening with the vaccination plan, as well as some other areas related to student attendance. So with that, I would like to first turn it over to our subcommittee chairs. And Dr. Hand, good morning. How are you? Oh, wait, mute.
Yep, I have it. Hi, everybody. Happy New Year. So we met yesterday as a subcommittee. The first thing we would like to say is thank you for, as the committee and the Board of Education for making the decision to, have a remote only week last week. We really thought that that was very helpful, and we appreciate that. We spoke a little bit about extended day programs, which we talked about before in the reopening committee. They're up and running successfully, so we're excited about that. Believe it or not, we're already planning for summer school, seeing how summer school plans may need to change, what kind of programs that we could put together to support the children who need that additional support. So, that's important work for us. And talked a little bit more about assessments. We were, the question about assessments, mid-year assessments, and the amount of time that it takes to administer mid-year assessments, especially at the elementary level, has been spoken about for probably the last 6 to 8 weeks. And just the commitment that we really need to know where our students are right now and where we are going to bring them to move them forward. So the assessment information is very important for informing our instructional practices and making decisions in the future. So just wanted to share that. And, we explored a little bit more about the AM, PM for the elementary schools. And really, nothing has changed in that area. It's just logistically challenging for us, the size of our district, the amount of instructional time that students would be exposed to, and also, the mandated services and the academic intervention support services that we offer. We wouldn't be able to fit that in that much of a modified day. Other than that, we're continuing with everything that we do to move the district forward. Kindergarten registration is ongoing. Right now, we're in an RFP process for the pre-K programs and, moving along. So thank you. And I'm very excited about the vaccine as well.
Thanks, Dr. Hand, and thanks to everybody on the committee. And a point, Dr. Hand, that you made related to, oh, go ahead.
Sorry about that. And most importantly, I think we have Emerly who wants to report out on inviting more students in to the high school. So is Emerly on the call this morning?
Yes.
Can't see everybody. Okay.
Thank you, Dr. Hand. So good morning, everybody. So we at the high school have always been trying to figure out how do we, continue to explore ways to bring in more students in a safe manner. And, over the last couple of months, we've reached out to families, surveyed them, as you recall, in some of our previous meetings, to get a feel as to how many families would be interested in having their student attend more than one day a week. So we've been able to look at that data and feel that based on our current numbers that we can absorb some of those numbers and allow some students to come in for a 2 days a week cohort. So we're exploring that. We're looking to make that finalize that for the third quarter. So I know Ernie and Daisy are looking at that as well. So we are right now, what we're doing is we've sent out a letter yesterday to families to just to make sure that they're aware that if, that whatever their status was for this the second quarter will roll over to the third quarter unless they want to make a change, that they should reach out to their school counselor, their child's counselor or house administrator to make that change. So once we get those numbers ready for the third quarter, we'll be able to plug in the students that have shown an interest for the 2 days a week cohort. So we'll be looking at a silver cohort being Monday, Tuesday, and a gold cohort being Thursday, Friday. And the beauty of that is that we're going to be able to manage and control that. So we'll know where to place the students. So therefore it will still be within our max capacity of our building. And that also includes the anticipation of all our hybrid students coming back in, because we know right now during the last month or so, we've had quite a few of our hybrid students that have been present virtually because of the concerns that they've had around the holiday season. So we took that into account as well. So that'll be effective for the third quarter, and we're hopeful that we'll be able to accommodate as many families as we can. However, we will, set up a waiting list if need be, but certainly we're going to be monitoring that throughout the third quarter as well.
Thank you, Mr. Martinez. I would be remiss if I didn't ask Mr. Spatafore, did you want to add to that at all, or did Emerly cover it?
Sure. We're using the same process, and we're sending that form out on Friday. We're going to be combining groups. We didn't use colors. We use number codes. So our attendance groups 1 and 2 could potentially be combined, and 3 and 4. So we're going to ask parents if they'd like their students to come in for an additional day per week. And then based on space considerations, we should be able to do that.
Great.
Thanks, Emerly.
Thank you both. I also just want to recognize at the high school that the athletic program will be moving forward, as well as training opportunities for off-season sports. I know many of our student athletes have been looking forward to that, and that is going to be kicking off on Monday. And all of that information has been shared through the athletic departments, available on the district's website as well, at the high school athletics page. So that's going to be great news also for our student athletes, and looking forward again to just more and more of that normalcy as we push through into the academic year. And for anybody who's watching at home and thinking about it, as we are, commencement. We fully anticipate celebrating our students in commencement exercises come June. And, it's probably, I can say, 75% certainty it's not going to be at the county center, because as you know, the county center is being used as a hub for vaccination distribution, and also the field hospital still exists. But we are planning and we'll have be set up to celebrate commencement at Laux. And more information will be coming out about that. I know the team at the high school's planning, the team at the middle school's planning, and that'll be fantastic. And so for our Tigers who watch the reopening committee meetings and who are going to be poised to either move up or graduate this year, hopefully that makes you smile too. I want to just take a moment. I know she's here, and I don't want to eat up any more of her day than we have to, but Dr. Longobardi has been amazing in terms of communicating and supporting us in the district. Doc, how are you?
Hi, good morning. Glad to be here.
Thank you so much for everything.
Yeah, very exciting news. You have more kids coming in. The vaccine, of course, amazing news. Hopefully the rollout will go a little bit faster. It's a big project. It's not as easy to, administer as the flu vaccine, where you pop into the drugstore and you pop out, sort of thing. But it's pretty simple, but there are some other things that make it go a little bit slower. I got mine on December 30th, Pfizer, and I'm looking forward to completing the series next week. So very exciting.
Outstanding. Thanks, Doc. And I just want to turn over to Dr. Vaccaro-Teich. I know you folks have been working hard too. Any updates?
I apologize, Joe. You might have, Dr. Ricca, you might have, kind of talked a little bit about the fact that we were looking to do some small testing at some of the buildings and trying to put that into place.
No, I left it all. I left the announcement for you.
So we're just, we want to be proactive, and we're, Nurse Maggie is working with us and trying to see how we could do some of the small testing at each of the buildings. So we're working to get the reporting process in place, and we'll be talking with Dr. Longobardi as well, and just try to do something to just kind of further our comfort level. So that's really been the focus. The district-wide health and safety committee met yesterday afternoon to do the required update to our district-wide plan in accordance with section 2801 of the law that was amended, so that we have to have, if there's a public health emergency, that our district-wide safety plan has to have a component regarding a declared emergency. So we've made those updates, and that will be going along for public comment. And in starting in February, and then in the March meeting, we'll have a public hearing and board adoption, and then filing with New York State. So, and Maggie, I'm sure you're going to talk about, or someone talked about the fact that we've been assigning seats in the cafeterias, certainly on buses, and that the DOH has lowered that quarantine period. So that's going to all help smooth our contact tracing and make that a little easier and less quarantine. So I think that's about it, unless somebody from operations has something else I left out.
I just want to say that the quarantining in the cafeteria is going to be huge, because it's going to be a game changer. We really want the kids to be in school when they are in school, not to be quarantined every time they go to school. So I've been working with the Department of Health, and they've been giving me some guidance, and I have gone out to some schools, or I've talked to the principals via the telephone. And I have to say that now everybody's going to be having like assigned seats and separate. And the quarantining is going to be a lot less for the staff as well as for the kids, so that if they do get exposed, we're not going to have a kid that's 500 feet away from the kid that's positive being quarantined. And we're going to be able to look in a chart or scan and see where that kid was sitting, so that we know which kids are going to be quarantined that surrounding area. I think that's going to be huge. We're going to be working with the buses as well. That's the next project on my list. And the one thing that we have to worry about the buses is that if the vents are closed or if the vents are open, because that's going to make a big difference in quarantining the kids. We certainly want to quarantine less, but we want to quarantine safely. So I think that that's going to be a huge thing for us. And I am so super excited about the vaccines. We are going to, anytime there's a link, anytime there's any availability for vaccines, I'm looking at all times to see, and I'm going to share it with the staff. I will put out something like a little a Q&A thing for the vaccines, like what to do, like if you go, make sure that you get an appointment before you leave. If Pfizer has to be 21 days later, Moderna is going to be 28 days. And if you're a little late or a little early, what are the rules with that? So I want to put something out so that the staff kind of knows. So, so that they have a better understanding of how the vaccines are going to be given out. We are on the list for White Plains Hospital. When they do get availability, they will let me know so I can send more staff there. And eventually they say that the vaccines are going to be in CVS's. I'm not sure if that's the case or not. So far, they don't have it. But if I could arrange a clinic at some point, I will do so as well. So that's my update. And we're going to try to do some testing, small testing. We did put in for the state to get that electronic record thing. And as soon as we get it and I speak to Dr. Longobardi, I'm going to try to figure that all out. So that's it, my update.
Thanks, Nurse Maggie. It's a great update. I see there's a question. Jen, I'll come back to you real quick. I just want a couple of quick things with regard to vaccination. I'm really pleased to share that we've taken the position that as soon as you can get an appointment, go get vaccinated. So the district is doing everything it can to make sure that regardless of when your time slot is, you can go over and you can get vaccinated if you're willing and able to do so. We're also encouraging people and spreading the communication and the facts related to the vaccine, so that if anybody does have any apprehensions or any concerns, we're encouraging them to talk to their healthcare providers, but we're also encouraging them to make sure that they're informed themselves and not informed via Facebook or informed via Instagram or even informed via watching, cable news. Make sure you take a look for yourself and recognize what this is and what it's not. In many ways, this vaccine has probably potential for fewer side effects because of the way the vaccine has been created. People think like, oh, it just came out of the sky 10 months ago. It didn't. The technology has been, scientists have been working on this type of a technology for viral intervention for decades. It is the ramping up and getting it out and manufactured that's been miraculous. So there's obviously apprehension out there, but we're really encouraging people, particularly in a community of education, to make sure that they're educated, talking to folks that they trust in medicine, and then if they're able and willing to get that vaccine. With regard to testing, you all know because we've been saying it for months, and it was great to hear the governor echo it yesterday. Yes, buy next now, rapid tests are not 100% reliable, no doubt about it, but they're better than nothing. So if we can, and not just here in White Plains, but all throughout the country and all throughout society, if we can offer rapid testing, again, it brings another positive intervention there to help us to identify situations where somebody may be infected, and at the very least, minimize potential exposure. So we're looking at that. I want to thank Dr. Longobardi. I want to thank Nurse Maggie. I want to thank the Westchester County Department of Health as well. We work with them all week long, every week. And we are right now in the process of communicating with the state of New York to get those tests for free, to be able to do screening testing here in a manageable way for folks who have identified that they'd be willing to participate in screening testing. So all really good stuff, all really exciting stuff. The changes in the Department of Health's guidance that came down from the New York State Department of Health guidance, like Maggie said, is really a game changer for us. Making sure that we don't have to have these huge swaths in contact trace is going to be helpful. The other question that's out there, and people have been asking me already, and this is the answer that we have. When I'm vaccinated, both courses, will I need to quarantine if I get caught up in a contact trace? The guidelines right now have not been changed. So if you have both your shots and you get caught up in a contact trace, the recommendation has been to communicate directly with the contact tracer so that they can communicate directly with the Department of Health and make determinations at that time. When the guidelines are updated, we will absolutely share those with folks so that they understand. I mean, some people say, well, if I'm vaccinated, why would I still have to quarantine? This is everything happens very fast, and we want to make sure that we're taking the appropriate steps and following all the guidance. So we'll communicate that with everybody as soon as we have any updates there. Okay, Jen for Hemming King. Good morning, Jen.
Good morning. I just had a question for Maggie. Maggie, are you collecting data from people who have been vaccinated so that you have a sense of the percentage of staff members and community members within the White Plains School District who are being vaccinated? Like, are we keeping track of that? I'm just wondering.
Right now, no, because basically I'm just telling everyone, if you can grab an appointment, grab an appointment. Certainly we can do some kinds of questionnaire to figure out how many people were vaccinated, but this is all so new, and we also have to give them an opportunity to vaccinate. Some people, we haven't been able to get so many appointments yet. And the appointments are sometimes in March, so, or February. People are not getting appointments like next week. Some have been able to, and some have not been able to. So my focus right now is trying to get as many appointments as we can for our staff. Secondarily, we can always do a questionnaire to find out how much staff did get, a second vaccine, but at this, and completely vaccinated. And I think that that's more important to know when they're completely vaccinated, so we really know who really had the full dose. So I think that would be a few months down the line.
That's a great question, Jennifer. We will have at least round percentages of individuals who are willing to share if they've been vaccinated, or any additional data that comes from health that's shared maybe community-wide down the road. But a question, and it's a good question, one of the questions that came up, well, will I be able to know if my child's teacher or aides, the teacher assistants in the classroom have been vaccinated? And unless those individual adults tell you, no, that's not something that would be part of a general conversation, just because of the privacy rights for individuals. But a good question, right? I also wanted to just give the opportunity, Ms. Algarden, there you are. How are you? Good morning.
Good morning, everybody. I just dropped my notes, excuse me. I just got so flustered. I just welcome the opportunity to update you and the community about where we are with both special education and social and emotional learning. First of all, there will be a coffee talk on Tuesday night. The link's going out today and will go out again on Tuesday morning for parents who want more information. At this point, with regard to students who currently have individual education plans, they in KM1, all of our special education students are in 4.5 days. All of our students K-12 who are in our self-contained classes are in 4.5 days. In addition to that, there are integrated students who receive integrated co-teaching services and an abundance of related services. They're in 4.5 days a week. And on top of that, there is an individual process that's occurring for every student who has an IEP. That process is that either the buildings or the parents and guardians are referring those students to the Committee for Special Education. There is a document that we go through that determines whether or not the nature of this impact, the nature of the closing, because of the student's disability, is impacting them. And so we are making individual decisions for individual students. And that process takes place quickly and expeditiously, so that if a student does need to be in school, they are in 4.5 days a week. So as a parent or a guardian, if you have concerns, please again, send a referral to the Committee on Special Education here at Ed House, either to my attention or the attention of our directors. Our numbers and names and emails are up on the website, and we will hold a meeting for your child quickly so that we can assess their needs. With regard to evaluations for our students with special needs, we continue to struggle with either getting kids in or moving those evaluations forward. So we will be in touch with individual parents whose students require evaluations, either for initial referrals to the Committee on Special Education or for reevaluations. The District Social and Emotional Learning Committee held its meeting at the end of December. I think it was the end of December now. And it was a really robust sharing of resources across the building. One example of that is Highlands had created an FAQ for students about COVID and the implications of COVID, and that was shared out across the district. So a very robust sharing of things that are happening in our buildings, from mindfulness to individual supports for students, to supports for faculty, like potluck dinners on Zooms, and opportunities in buildings to get together and just talk and process. Moving forward, the committee is now going to shift to a much more proactive approach to social and emotional learning, thinking about the recommendations that were made through the Castle audit before schools closed in December, because what we know is that social and emotional learning is much broader than mental health, trauma. It's really about building strong citizens and strong learners, right? Who have the ability to self-regulate, the ability to set goals, the ability to take ownership of work, of their school work. And so our focus is now going to shift where as the vaccine rolls out and as more and more children return to school, to a much more proactive way to embed SEL throughout the school day. And certainly that will be part of the diversity work as well, because diversity, equity, and SEL are very much aligned to one another. And then the final thing is we are broadening our partnership with Andrus, continuing to broadening our partnership. We have gotten a little stalled because of the pandemic, but I know that plans are going up for Church Street and MAS. And so hopefully in September, we'll be opening with clinics in 4 buildings as opposed to the 2 buildings that Andrus supports right now. Thank you, everybody.
Thanks, Deb. Mrs. Lyons, I see you had a question. I can come back to you though if you.
No, I'm okay. So basically what I wanted to say is I wanted to thank Maggie. I think there's a perception out in the community that somehow school districts or unions have access to the vaccines. And that announcement came out ahead of the infrastructure being put in place for those. And I know Nurse Maggie, and I know you, Dr. Ricca, had hoped that we could have some kind of on-site situation happen, and we just don't have access. It's not because we don't want to support folks in getting those vaccines. And I just wanted to thank Maggie for all of those efforts, because I know you're still working on trying to help folks get slots earlier. And I wanted just the folks in the public to hear that and know that that work is happening behind the scenes, and to recognize that as well. So thank you.
Oh, that's a really great point, Mrs. Lyons. And also I learned this from somebody, a little vaccine hack. If you're on the site and all of the appointments are filled and you keep refreshing, there's a possibility that appointments will open up because people make cancellations. I know several people who within 5 minutes were able to get an appointment the same day or next day. So if you have a couple of minutes and you want to try that, that is also a possibility. But yes, Kara, to your point, we don't have access to the vaccine. And when that information did come out, and in some ways, I think it was confusing to many folks, not just education unions, but also first responder unions as well. It really did, I think, confuse some people, but great point. Thank you very much. And to that point, I'd also just like to recognize and thank, I did this on Monday at the board meeting as well, the ASA, the CSEA, and the WPTA for working really side by side with us to communicate to the many, many thousands of people who need to hear information as quickly as possible, and most importantly, as accurately as possible. So thanks, partners, for that. I think that has gone a long way to avoiding some confusion in the White Plains City School District that unfortunately we are seeing happen in other places around the state. And we'll keep doing that, getting that information out to folks. I also wanted to make sure that Mr. Pepper had the opportunity to, and Scott, I don't know if there really are any major changes, but please.
Good morning, everyone. There really have not been any significant changes. Everybody, I think, is aware that the benefits under the FFCRA did expire on December 31st, which obviously has created a little bit of a challenge for us, although in just taking a look at our absenteeism, our absentee rate, it's actually improving a little bit, and that's so that's a good thing. So that's an encouraging sign. Overall, our numbers are down. I want to just take a moment and thank our building-based administrators for doing really a excellent job of trying to cover classes for teachers and provide a continuing learning process for the students. It's been a tremendous challenge, very much a strain on them, and we're very, very grateful for everything they're doing at the building level to make it work and to keep things moving down the road. Dr. Ricca mentioned the vaccine. We are being very generous in terms of our allowing staff members to go whenever they can we think it's really important, get a vaccine, get vaccinated. That's critically important. We want that to happen. And again, the burden for that will fall on the administrators. And I want to thank them for being flexible and providing those coverages so that the teachers can step out of the building for an hour or so to get that taken care of. And that's basically it. So thank all of you, and hope everybody has a great day.
Thanks, Scott. Really appreciate it. Just a word about the full remote last week for folks who were thinking about, well, was that a good call? In hindsight, most things are 2020. And when you look back at it last week and the number of cases that were identified throughout the course of the week, turned out to be a good call. That, you know, and those decisions are not, everybody knows this, especially on this committee, are not easy decisions. They're based on experience, and they're based on what we've learned, and they're based on the things that we can determine are as best as we can, best practices in the present situation. So while we know it was disruptive, the hope was that it minimized the potential for additional quarantines. It minimized the potential for additional loss of in-person instruction this week. And again, despite rising numbers in and around some of our surrounding areas, we were able to welcome our children back on Monday, and that's good news. And as Maggie mentioned, coupled with the changes in the requirements for the quarantining, that's really helpful, I think, to all of us. So we'll keep a very close eye on everything that's happening, and make sure that we communicate any needed changes or scheduling adjustments. And we hope that there aren't any as we press on into the winter months. Any general questions, comments, or concerns from the committee? All right. Remember, we are meeting now every other week. So you have next Wednesday off. Yeah, right. And we'll be back for reopening the following Wednesday. Thank you, everybody. Thanks for your continued dedication and efforts and in support of our children. Have a great day.